Hey guys, I was gonna tell y'all, I woke up on Monday, January the 21st, and I couldn't move this hand, and um, it hurt really, really bad. And so, um, um, I went to work the next day. I called my boss and told her, can I come in late? Because I just wasn't feeling it, and I was hoping that I'd start feeling better. And still, I couldn't move this hand. I couldn't make a fist. I couldn't do anything, and I was so tired. I just didn't feel well. My boss said, "Bertie, you might need to go to the doctor." I said, "I have an appointment tomorrow because I had an appointment Wednesday to go to have my thyroid ultrasound." And I thought I'll just go to the ER when I'm getting my thyroid ultrasound. So I went and got my thyroid ultrasound, and then I went to the ER um, at the clinic, and they thought I had sepsis, and so they sent me by an ambulance to St. Francis. So on St. Francis, I got admitted into the hospital on January the 22nd, and I got discharged on um, January the 31st. And here's my summary of my report. And they told me what medicines to take. I have to get, for 8 weeks, I have to give myself infusions of antibiotics and called Vancomycin. It's Vancomycin. It's Vancocin. I have to take that, and I have to take that for 8 weeks daily, and so I was discharged. And then it said that I had spectrum cultures with spam grade sepsis, um, and and then it says that I'll have a follow-up visit on February 26th, and will of course have my doctor's visit with my cancer doctor, and then I have my shot for my lanitide, and then it said that uh, that I had cellulitis in my hand, and cellulitis of my head. And then it just tells me what medicine I'm supposed to start taking. Because they gave me a couple of neo for nerve stuff and for pain, and they gave me oxycodone for pain too. And then yeah, and it says cellulitis. Cellulitis is a skin infection that affects areas, is usually warm, red, swollen, and tender. This condition occurs most often in the arms and lower legs. The infection can travel to the muscle, blood, underlying tissue, and become serious. It is very important to get treated for this condition. What are the causes? Cellulitis is caused by bacteria. The bacteria enters through a break of the skin, such as a cut, burn, insect bite, open sore, or crack. What increases your risk? This condition is most likely to occur in people who have a weak body immune system, have open wounds on the skin, such as cuts, burns, bites, and scrapes. Bacteria can enter the body through those wounds. Other adult are older than 60 years old, have diabetes, have a type of long-lasting chronic liver disease or kidney disease, are obese, have a skin condition such as itchy rashes, eczema, slow movement of the blood in the veins, fluid buildup below the skin, edema, have had radiation therapy or use IV drugs. What are signs and symptoms? Symptoms of this condition occur: redness, streaks, and spotting of the skin, swollen area of the skin, tenderness and or pain when the area of the skin is touched, warm skin, a fever, chill, blisters. How is this diagnosed? This condition is diagnosed based on medical history and physical exam. You may also have tests including blood test, image test. How is it treated? Treatment is for this condition may include medicine such as antibiotic medicine or medicine to treat allergies, supportive care such as rest and application of cold and warm cloths to the skin, health care if the condition is severe, hospital care if the condition is severe. This infection usually starts to get better within 1 to 2 days of treatment. Follow these instructions at home. It says medicine, take over-the-counter or prescription medicine only as told by your healthcare provider. If you were prescribed an antibiotic medicine, take it as told by the healthcare provider. Do not stop taking the antibiotic even if you start to feel better. General instructions: drink enough fluid to keep your urine pale white. Do not touch or rub the affected area. And I am sitting here doing this. Rinse and raise the affected area above the level of your heart while you are sitting or lying down. Apply warm or cold compresses to the affected area as told by your healthcare provider. Keep all follow-up visits as told by your healthcare provider. This is important. These visits let your healthcare provider make sure a more serious infection is not developing. Contact the healthcare provider if you have a fever, the symptoms do not improve within 1 or 2 days of starting treatment. Your bone and joints under the infected area become painful after the skin has healed. Your infection returns to the same area or another area. You notice a swollen bump on the affected area. You develop new symptoms. You have general ill feelings like with muscle aches and pains. Get help right away. If your symptoms get worse, you feel very sleepy, you develop vomiting or diarrhea that persist. You've noticed red streaks coming from the affected area. Your red area gets larger and turns dark in color. These symptoms may represent a serious problem that is in an emergency. Do not wait to see if the symptoms will go away. Get medical help right away. Call your local emergency services, 911. Do not drive yourself to the hospital. Summary. Cellulitis is a skin infection. The condition occurs most often in the arms or legs. Treatment for this condition may include medications such as antibiotic medicine and antihistamines. Take over-the-counter and prescription medicine only as told by the healthcare provider. If you are prescribed an antibiotic medicine, do not stop taking the antibiotic even if you start to feel better. Contact the healthcare provider if your symptoms do not begin to improve within 1 to 2 days to start treatment or your symptoms get worse. Keep all follow-up visits as told by your healthcare provider. This is important. These visits let your healthcare provider make sure that a more serious infection is not developing. The information is not intended to replace giving advice from your healthcare provider. Make sure you discuss any questions you have with your healthcare provider. And then it gives you community services if anybody needs anything, fall information, And then I've been prescribed antibiotics. I'm going to be taking them for 8 weeks. And then it just says what the side effects of those antibiotics could result from. And then I have to have a checkup once a week because I got to clean this out and take blood to make sure that this antibiotic isn't messing with my kidneys. And then it just talks about the opioids because they gave me pain pills. And then understanding and preventing blood clots, they have that in here. If y'all want me to read that, just let me know and I'll read it to y'all. And then it says, what is sepsis? And then it says, sepsis is the body's overwhelm and life-threatening response to infection or injury. Sepsis can lead to tissue damage, organ failure, and death. Any type of infection anywhere in the body can cause sepsis. Sepsis can occur from many types of infections such as pneumonia in the lungs, urinary tract, skin wounds, and gut. Generally, the cause of sepsis is a bacterial infection. However, viral infections, seasonal colds or COVID, as well as pesticide or fungal infections may also cause sepsis. Who is at high risk of sepsis? Adults 65 years and older, babies or very young children, people with chronic medical conditions, diabetes, lung, kidney, and liver disease, cancer, kidney disease, people with weakened immune systems, and people with severe injuries or burns. What are the symptoms of sepsis? Sepsis: S, shivering, fever, and very cold. E, extreme pain and discomfort. P, pale and discolored skin. Sleepy, difficult in waking up, confusion. I feel like I might die. Shortness of breath, increased difficulty breathing. Fast heart rate, racing heart is also a sign of sepsis. How do you get diagnosed sepsis? Doctors diagnose sepsis by the patient's symptoms and by lab work. Symptoms like fever or difficult breathing are also common in other conditions, making sepsis harder to diagnose in the early stages. The patient may receive blood lab tests and x-rays to check for infection. If the suspect sepsis or have a combination of these symptoms, contact your healthcare provider, call 911, and go to the nearest emergency care immediately. It says, what is the treatment for sepsis? Patients receive treatment as sepsis in the hospital. Doctors try the treatment, treat the infection, keep the vital organs working, and prevent a drop in blood pressure. Patients usually receive antibiotics given as soon as possible to treat infection. Intravenous IV fluids help the patient's blood pressure. Oxygen helps the patient's blood oxygen level. At times, depending on how serious the sepsis is, patients may also require mechanical intervention, a machine that will help the patient breathe. Dialysis, a machine that filters harmful waste, salt, and excess water from the blood because the patient's kidneys are not working properly. Surgery, sometimes needed to remove tissue damage from sepsis. What can I do to prevent sepsis? Keep vaccinated, help your immune systems fight viruses, take antibiotics correctly if prescribed, wash your hands before eating or handling food, after using the bathroom, after touching pets or other animals, after blowing your nose or coughing. Care for open wounds. Harmful bacteria can enter the skin through cuts, scrapes, and breaks. Keep wounds clean. Watch for signs and symptoms of infection: redness, area warm to touch, increased pain, increased discoloration, and foul smell discharge. If you have an infection, look for these signs like fever, chills, fast heart rate, difficult breathing, extreme pain, hard to wake up and confused rash. And then it just, so they thought that they think that I had sepsis and that I had cellulitis. Um, so they started treating me with antibiotics, and I had MRSA in my blood, and so I had to have cultures clean. They wanted me to have a clean culture of blood 3 times, so that was each time you do it, the blood has to be 48 hours old. So I had to have it for every 2 days. I had to have my blood checked to see if it had come clean, and it came clean from MRSA. It came clean 3 times that I had a negative culture. When I was there, my lips were getting chapped, so my best friend Tara, she came down, and she had given me she had got me chapstick, and she got me a cherry slush from Sonic. And then my friend Connie came every day, and thank goodness, to keep me company. She came every day after work and stayed with me from like 4:30 until almost 7. And she brought me supper, and she knew that I was going to be short on money, and so she gave me money so that Willie Joe would have money to come back and forth. And so she gave me some money, which was a blessing, because you know, I was going to be short on my house payment, and I was worried because Willie Joe was wanting to come up there, but I kept telling him no because we didn't have the money. And then Willie Joe got me a couple of boxes of chocolate for my nurses. So every nurse I had and every nurse tech I had, I gave them a box of chocolate because they were really, 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 really good to me. And Willie Joe got me a heating pad. You put this in the microwave and you can set it on your deal. It's a warm compress. Isn't that so cute? And he got me this little bitty turtle. Isn't he so cute? It's called a palm pal. But I thought this was just a cute idea. You just put it in the microwave and it's a heating pad. So now if my arm gets to feeling weird again, I can always have that on there. And then he got me sweethearts, you know, candy hearts. Yep. So, man, yep, it was bad. It was really bad. Even when I had my kidney out, I did not stay that long in the hospital. So I was in the hospital from the 22nd until the 31st. And when I had my kidney taken out for my cancer, I was in the hospital I went in there Wednesday to have my kidney out, and I was out. I had to stay all night because they were afraid that they were afraid that I had stage 4 cancer, because I had it in 2 places, and they didn't even know it was in 2 places. So they took my kidney out, and when they opened me up, there was 2 more spots, and luckily they were 2 different cancers. So that was my kidney cancer, and then my carcinoid cancer, which is a non-curable cancer that I have, and I take shots for it. I see that doctor this coming up Friday, but they changed that, so I'll see him on the 14th when I have my cancer shot. And then Friday they called me and told me that the ultrasound didn't look good, so they want to do a biopsy. So I guess in 8 weeks after I stop doing the antibiotics, I'll do the biopsy to see what the abnormality was on my thyroid. So this year, please keep me in y'all's prayers, and this year better get better. Because, man, I've used all my vacation because I had to stay in the hospital, and I sure don't want to lose my job. But my bills did get paid. Thank God. Thank you, Connie, so much. Yep. Connie was a blessing. But she's also a blessing because she came to the hospital every day to be with me, which was awesome. We would enjoy supper together, and then she would stay and jabber with me until as long as she could. So from 4:30 until about 7 every night was awesome. Yep. And then Tara called me and checked on me, and so did my boss Farrell. But some of my friends didn't check on me, which was kind of sad, you know. And my cousin Laura called and checked on me all the time. So yeah, some people are blessings, you know. And thank you guys, and I will let y'all go. And I love y'all. Bye. Okay, guys, I gotta do my iron infusion. So if you look at my table, you're gonna see all this stuff on there. So I have saline, my antibiotic saline, and then my blood, the cleaner out. So I'm hooked up right here, and so I take this out, and I'm hooked up like this, and I'm going to tear this alcohol open, and then unscrew this right here. Unscrew that right there. We're going to clean around this for 30 seconds. So we're going to go 1, 2, 3, 4, 5, 6, 7, 8, 9, just in case. Okay. Alright. And then we are going to undo this. You're going to push and then you're going to get out all the air bubbles on the top. And once we get out all the air bubbles on the top, we're going to hook it in. Screw that on. And then we're going to push a little. Push a little in there. Pause. And then push the rest of it in. Okay. And after we get that in there, we're going to unscrew this again. clean it again for 30 seconds. Okay, then we're gonna pop this open. And then we're gonna stick that in there. And this is my IV antibiotic, and this is what it looks like. And then we're going to pop this open. See where it's not open? We're going to move it down. We're going to massage the vein to get the kink out. And then it should be working. Does it look like it's going in, Willie? I guess we'll know if it doesn't start deleting, right, Willie? Okay. And then this ball right here will last for 2 hours, right, Willie?
Yeah.
Okay. Alright. So, we'll watch and see. Talk to y'all later. Thanks. Bye. It's been 2 hours. It's been 2 hours. So, now I gotta flush it. So I have to flush it and so now you see what it looks like? It's all flat. And I have to take it apart. Clean it for 30 seconds. Then we take this one, this is some saline, and then we pop it, and then you see where it has the air, and then we have to take out all the air, put it back in here. Then we gotta put a little bit in to make sure it's going in like it's supposed to. And then we do the rest of it. And then we'll take it off. Up. And clean it again for 30 seconds. Okay, and now for the anti-clogging. Okay. And then we have to get the air bubbles out of this one. Okay. Hook it up. Do a little, and then do all of it. And then on this right here, these caps, you take it off really easy because on the inside it's got the alcohol and the cleansing stuff already in there. And then you just put on the top, and then I take this and then I pack it inside here. so that it's just not hanging loose. And then in 24 hours, I have to do it all over again. And I'll be doing that for 8 weeks.